So dark markers like this, in this particular case, it was a tumor in the uterus. So that's the vagina and uterus area. But when you get dark markers like that, remember I said the darker it gets, more toxic it is? Yeah. So these marks are called trauma forks. And they usually say, look at me, 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 in those areas. And they are serious again. They could mean that you've had trauma to that area, you've had surgery, but it also could mean that there's a more serious potential in that area. And then darker marks like this, and in this particular case it was lung cancer. And so this particular eye is a right eye, and right here at 3 o'clock is the lung area. So, lots of information, eh? Lots of information, little things timed together. So, remember the book, Cancer's Not a Disease, It's a Survival Mechanism? And he talked about, you know, stress and worry and all of that kind of stuff. So fear is among that. And a lot of times what happens when people get sick, one of the things a lot of times comes first to their mind is, if they don't know what's going on, what do they think? Sorry?
They're going to die?
They're going to die. Or a lot of people automatically go to the big C. They just think, I have the big C. So with that, it's fear. And again, that fear, like stress in your body, takes things away from your body, right? And is depleting you. So again, you have to go to the root cause instead of just treating the symptoms. So, fear, anxiety, stress, worry, concern, resentment, hatred, any of those emotions that create that negative feeling within your body. So even your subconscious mind cannot tell the difference between if you're going, oh, maybe it's this, maybe it's that, I'm going to worry about this, I'm going to worry about that, or the reality of if something really is wrong. The subconscious mind cannot tell the difference. So sometimes just who we are in our worried state can create more situations than are there. So, back again. If cancer does not need oxygen to grow, then maybe, just maybe, we need to think about something other than a physical component that might be creating cancer or dis-ease in the body. Does that make sense? Because when there's fear, there's question, there's worry. But the more information you have, the more power you have. Because when you have information, you worry less, correct? And then you have more choices for your health and wellness. So, let's just do a quick overview. So, Eli Jones, 80% using homeopathic medicine and the constitutional approach. Dr. Banerjee, 44% using homeopathic medicine, but they don't use the constitutional approach. Homeopathic approach to cancer, Hodgkin's 77, brain cancer 70, lung 58, prostate 80, breast 80, homeopathic medicine and the constitutional approach. Then we had SCIT, we had the Gerson therapy, which was juicing and the coffee enemas, and Dr. Riki's book, And Cancer is Not a Disease. So all of these ones didn't exactly have stats, same, but they all talked about how they were curing through their different methods of cancer, curing cancer. Allopathic or pharmaceutical, from the stats we pulled up, 4% have a long term after having chemotherapy. And the stats that we pulled up in Canada, 1 in 3 in 2012 are going to die getting cancer. So, for your information, IPA iridology and classical homeopathy deal with the constitutional approach in your body. So, medicine, so here, remember I said I was getting ahead of myself? Homeopathic medicine was the first regulated medicine in Ontario. Before pharmaceutical medicine was even invented, homeopathic medicine was being used. And being there. So homeopathic medicine is, here's where people, you'll read controversy about homeopathic medicine saying there's no scientific research. Did I not show you scientific research already done? That's already been printed in the oncology journals, right? And you can go look them up. But the challenge is the way homeopathic medicine works in the body and how homeopathic medicine is proven, and that's exactly what we call it. We do a proving with homeopathic medicine. It doesn't fit the standards of what pharmaceutical medicine called research. So therefore, it's negated. Okay? Homeopathic medicine is energy. We heard that word before. Where did we hear that word before? We heard the word energy. Actually, somebody won a Nobel Peace Prize in Medicine, right? In 1931, using the word energy. I don't know, but when I look at stats, can you go back one, please? Thanks. When I look at stats like this, that say in the late 1800s, early 1900s, 80% cures using homeopathic medicine, 44%, all of these stats there using homeopathic medicine, and homeopathic medicine is an energy, maybe that is the key. Maybe that is why homeopathic medicine worked well. So for me, this has been a journey. But for me, I can't sit still about this. As I learn this information, it would be wrong of me to not get involved and do something so that I can educate people so that they have a choice. So just like this says, our lives begin to end the day we become silent about things that really matter. So I thank you for listening to me. I'm going to turn the video camera off and then I will answer all of your questions, okay? Thanks.